Greetings from Indian Journal of Anaesthesia. I, Dr. Renuki Sharma, will be presenting an article published in the February 2025 issue of the Indian Journal of Anaesthesia. It is titled Effect on the Size of Optic Nerve Sheath Diameter in Patients Undergoing Surgeries Under Spinal Anesthesia versus Peripheral Nerve Block, a randomized control study. PDPH is a rare complication of neuraxial anesthesia caused by intracranial hypotension. Severe cases can lead to cerebral venous thrombosis or subdural hematoma. Optic nerve sheath diameter assessment using ultrasound is a validated tool for diagnosing intracranial hypertension and could also help predict postdural puncture headache. The PDPH incidence varies, occurring in about 36% of the lumbar punctures, 0 to 10% of the spinal anesthesia cases, and 81% of the accidental dural punctures. The diagnosis is mainly clinical, but MRI findings in PDPH patients often show venous distension in the lateral sinus. So this study aimed to assess the changes in optic nerve sheath diameter after the spinal anesthesia, hypothesizing that a decrease in size post-operatively. So the primary objective was the change in ONSD after spinal anesthesia in the post-operative period. The secondary outcomes were the assessment of variation in diameter based on position and to document occurrence of any headache, nausea, vomiting, or tinnitus. So Institutional Ethical Committee approval was taken and the trial was registered in CTRI. This study design was a randomized controlled trial including participants of ASA grade 1 to 2 having surgeries under spinal anesthesia or peripheral nerve block with a duration of less than 3 hours. Pregnant patients, patients with raised intracranial hypertension, bleeding disorders, large hernias, obese patients, and emergency surgeries and patients with eye pathologies were excluded from the study. Written informed consent was obtained and two anesthesiologists performed ONSD at preoperatively for baseline measurement of the optic nerve sheath diameter. The patients were then randomized into two groups by computer-generated random number table. The group S, which was spinal anesthesia, and group P, that was the peripheral nerve block. And this ONSD was again re-performed at 4 hours and 24 hours. So a linear transducer was used and the optic nerve sheath diameter was measured at a depth of 3 millimeter from the optic head at the sagittal and the transverse plane, and the diameter was measured preoperatively. After that, in the OT, ASA standard monitors were connected and an 18-gauge IV cannula was used in both the groups, and after which group-specific either spinal anesthesia in the sitting position was given or a group-specific block was given. In the spinal anesthesia, all patients received 3 ml of 0.5% bupivacaine heavy, and then patients were monitored for PDPH. This PDPH was defined as headache occurring within 24 hours of spinal anesthesia that intensifies within 15 minutes of sitting or standing and subsides within 15 minutes of lying down. It is associated with neck stiffness, tinnitus, hyperacusis, photophobia, nausea. So the primary outcome was the change in ONSD at 4 hours and 24 hours after introducing local anesthesia in the subarachnoid space. The secondary outcomes are presence of headache, nausea, vomiting, or tinnitus. Sample size was based on a previous study that found that the ONSD of more than 0.5 millimeter is significant. That is 10% of the mean ONSD of 4.9 millimeter in asymptomatic patients. So taking these as reference values at 95% power, 94% significance, and having a 15% dropout rates, the sample size came out to be 23 per group. So this is the concert diagram that shows that 61 patients were assessed for eligibility and 23 patients were assessed, analyzed in both the groups. This is the table showing the baseline demographic and surgical data, which was similar between the two groups. Coming to the primary outcome, that is the ONSD between the two groups at 4 hours and 24 hours after anesthesia, it is found that it differed significantly, with the spinal group having lower ONSD at 4 hours and 24 hours after anesthesia. But in intra-group difference, at 4 hours and 24 hours in sitting and supine position did not differ significantly in both the groups. So this study found a significant reduction in ONSD at 4 and 24 hours post-op spinal anesthesia, though changes with posture were not statistically significant. Postdural puncture headache is linked to intracranial hypertension due to CSF leakage, and ONSD measurement could help in early identification. Ultrasound-based ONSD assessment is a simple real-time method for evaluating intracranial pressure changes, and no patients reported PDPH in follow-up, possibly due to the small sample size aligning with the prior studies showing varied incidence rates. Literature on reduced ONSD after spinal anesthesia is scarce, highlighting a need for further research. The study limitations include a small sample size, short follow-up period, and potential variability in measurement due to examiner technique. So from this study, it can be concluded that spinal anesthesia caused a slight reduction in ONSD compared to peripheral nerve block at 4 and 24 hours. The postural changes in ONSD were not significantly different within the groups. And the perioperative ONSD measurement is a simple, cost-effective, and a repeatable tool. And it can provide insights into the PDPH mechanisms, especially patients with headaches. Thank you.